Hi everyone. So good afternoon. Welcome to Tuesday Reading Live. This is me Vandana PS joining you from Needu's Academy. How are you all? All of you doing good? Okay, so after a long time I'm meeting you guys. So in this video we will be dealing with part A in detail. So I'll show you the material on the screen, then we will discuss the material. Alright, so this is the new material, cardiac tamponade. Okay. So yes, tell me, so what do you know about part A? Yes, what is part A? Okay, so what is part A? What is the importance of doing part A in this reading material? So as you know, we have 3 different parts in reading module. So that is part A, part B and part C. So what is the importance of part A? So what is part A? What is the connection with your day-to-day activities and doing part A? Is there any connection? So what is the importance of reading module? What is the connection with part A? Okay, so for example, I can say that, suppose you guys are working in a foreign hospital, okay, and you are not aware of any procedures. For example, I can say, your doctor asked you to take a particular procedure or a sample from a patient. And if you have no idea how to take that particular sample from the patient, then what will you do? Okay, if you have no idea about what is reading or what is the importance of part A, then you will inform your senior maybe, okay, or you will collect some details from the doctor itself, or you will inform a nurse in charge, right? Okay, so if you have an idea regarding what is part A, then what you will do? You will take the hard copy or the soft copy, then you will search for that particular procedure from that hard copy or soft copy. Then you will locate that particular answer from it. So that is the importance of doing part A, locating specific answers from part A. Okay, clear? So I hope it is clear for you. Then coming to the questions. Okay, so we have total 20 questions in part A. Clear? 20 questions. So these 20 questions, they have categorized into 3 different sessions. So 1 to 7 set of questions that can be called match the following. Then 8 to 14 set of questions that can be called what? Short answer questions. And the rest of the questions, which is 15 to 20, that can be called fill in the blanks. Clear? Okay. Yes, what about the timing? So we have total 60-minute exam, 1 hour exam. So out of the 60 minutes, we are spending maximum, not more than that. So I can say exactly 15 minutes for part A. Okay, so we are spending 15 minutes for doing part A. Total number of questions, 20. Okay, so here we have a total different topic from part A, a new topic from part A. That is cardiac tamponade. Okay, so now let me discuss with you regarding what is the strategy that we are using here, or what method we are using to complete this part A. So for that, you can use the method called skimming and scanning. So what is skimming and scanning? Any idea what is skimming and what is scanning? Okay, so skimming, which means fast reading or speed reading, whereas scanning, which means you are searching for some important or keywords from the text. Okay, so text, which means we have 4 different texts. Okay, that is text A, text B, text C and text D. So each of the texts will be different from one another. And we have a pictorial of something, maybe a chart or a diagram, okay, or a table. So something that contains all the information regarding the particular disease condition maybe. Okay, so that's all about skimming and scanning. So for skimming and scanning, once again, I'm coming back to this particular strategy, skimming and scanning. So fast reading. If you know the language, it is very easy. You can read whatever you want, but there is no connection with cognitive purpose or thinking. But here in doing part A, we have to think about it. So that particular point of cognition should be there. Okay, so we have to connect with fast reading plus what? Scanning or searching for this important words. Okay, understood? Yes. So now let's read text A. Then we will underline some important words from text A. So when you underline important words, we have a certain order for that, a systematic approach for that. Okay, I can say you can mark almost 13 keywords. Okay, so 13 keywords. So first one, if there is any title mentioned, you can mark all the headings or the title from each of the text. Okay, so as you can see here, there is no title from text A. Okay, if it is not mentioned, you don't have to mark because there is no title. Then, if there is any subtitle mentioned, you can mark all the subtitles. So, heading, subheading, then all the numbers. All the numbers. Maybe that numbers may be mentioned in words or in figures, whatever it is. If it is mentioned about any numbers, you can mark all the numbers. Okay. Then the fourth one is signs and symbols. Not symptoms, okay? Signs and symbols. What are the signs and symbols mentioned? You can mark all the signs and symbols. Then the fifth one is all about names. I can say, yeah, pronouns. Okay, maybe name of a person, disease condition, a particular country, whatever names, maybe an equipment. Okay, whatever names they have mentioned, you can mark all the names. Then sixth one, abbreviations, or I can say the short forms. Okay, for example, necrotizing enterocolitis is a full form of NEC. So you can mark those kind of abbreviations. Okay, and the next important factor or the next important thing is all the italicized or bold words. Okay, and another important factor, it is all about what? That words which are in brackets. Okay, something mentioned in brackets. It is very important. Then the words that indicate time. Okay, so when you read something, exactly the text, it is very important to mark some words that indicate time. Okay, then the words that indicate experiment, the words that indicate research related words. Okay, as well as the words that indicate experiment and research. Then also the first and last line of each and every paragraph, as well as all the bullet points. If the bullet points are very small, then you can mark all the bullet points in order. Okay, otherwise if it is very lengthier, you don't have to mark it completely, but it's okay, you can mark the important keywords from them also. Clear? So that's all about the 13 keywords. So now we are reading. Okay, text A, B, C and D. So coming to text A. Cardiac tamponade. So first of all, I'm marking the condition called cardiac tamponade. Happens when the fluid sac, so I'm marking the word fluid sac, around your heart fills with too much blood or other fluid and puts pressure on your heart. This prevents your heart's chambers from filling properly. So I'm marking the word chambers. So that is the name of some part or some equipment. Yeah, chambers. Then when your heart, so I'm marking the word when, that indicates time. So when your heart can't fill with blood properly, it cannot pump as much blood and your blood pressure drops. Certain diseases can cause cardiac tamponade. So I'm marking diseases. Okay, that's all about the second para. Then this condition can happen to people of all ages. About 2 out of every 10,000 people get cardiac tamponade from other diseases. So my keywords, it is 2 and 10,000. Those are numbers, right? Yeah. Then in some cases, cardiac tamponade can also happen after. So I'm marking the word after, which indicates time. A medical procedure. So I'm marking the word procedure, which indicates something that is, that can be related with experiment procedures. Okay. Then some of these include surgery. Again, the word surgery. On your heart or near the pericardium. Okay. Then catheter. The word catheter, name of an equipment. Procedures. Again, procedures I'm marking that involve your heart or surrounding blood vessels. Placement of device like a pacemaker. So again, I'm marking the device pacemaker. So these are my keywords from text A. I hope it is clear for you. Okay. So cardiac tamponade, name of a disease condition. Then fluid sac, another name mentioned. Chambers is name. When that word indicates time. Diseases that can be related with what? Research, as well as what? You can connect with experiment also, disease conditions. Then 2 and 10,000 you can relate with numbers. After, yes, time, procedure, yes, can be connected with experiment, surgery, pericardium, catheter, pacemaker. So these are all my keywords from text A. Okay. Then I'm moving to text B. Yeah. So what about text B? And for example, in summary, you can say text A is all about this particular disease condition and then the prevalence as well as the types, okay, or the chances. Then text B, yes, it's all about symptoms. So here we have a subtitle, symptoms. Okay, then when this condition happens quickly, so I'm marking the word when, then cardiac tamponade symptoms may include, so again I'm marking the disease condition, sharp pain in the chest. The pain may also radiate or extend to nearby parts of the body like your arm, back, neck or shoulder. So I'm marking all the body parts, arm, back, neck, shoulder. It may also get worse when you breathe deeply, lie flat or cough. Okay, then trouble breathing or breathing rapidly, fainting, dizziness or lightheadedness, changes in skin color, especially pale gray or blue tinted skin. Then heart palpitations, where you become unpleasantly aware of your heartbeat. Then fast pulse. Then altered mental status. So I'm marking the word altered. Okay, a person with cardiac tamponade won't act like themselves and may act confused or agitated. Then when the condition happens more slowly, you may also have these cardiac tamponade symptoms: shortness of breath, swelling in your abdomen or legs, fatigue or tiredness, chest discomfort that typically gets better when you lean forward or sit up. Okay, so these are my keywords again from text B. Okay, so now we are moving to text C. As you can see here, this is all about a picture. Okay, a table, something mentioned, cardiac tamponade diagnostic study. So this is all about the diagnosis. So how we are doing diagnosis? Through different tests maybe. A chest film is used to determine is a word that indicates experiment, the presence of cardiac enlargement, mediastinal widening. Then electrocardiogram, that is ECG short form mentioned, may show non-specific abnormalities including ST segment elevations and T wave changes. Then echocardiography, catheterization. So these are my keywords from text C. Clear? Okay, so now we are moving to text D, management of cardiac tamponade. So what about the management? Okay, so text C was all about the disease, diagnosis of this disease condition, and text D is all about the management. So yeah, management. So what are the management options? If it is medical, then you can go for step 1, step 2 and step 3 procedures mentioned. If it is a procedural intervention, then you can go for again preparation, then pericardiocentesis as well as different types mentioned. Step 2, yes, again step 3, removal of drain. So this is all about the text. Okay, so after reading the text within 2 minutes, I would like to, or I would understand that, okay, text is all about the disease condition, prevalence and all. Text B is all about the symptoms, signs and symptoms. Text C is all about its diagnosis, and text D is all about the management. Very simple. Clear? Okay. Okay, hi Mavji. Yes, Reba, good afternoon. Yes. Okay. So now the first question. Yes. So when you read a question from part A, it's very important you have to mark the keywords from the question, maximum 3, not more than that. Okay. So common discoloration seen in patients with cardiac tamponade. So my keywords, it is discoloration, common as well as, yeah, these are only the keywords I'm marking, only 2 keywords from the question, common discoloration. So where is it mentioned regarding common discoloration? So when you think about it, common discoloration, which means it is one of the sign. Okay, so where they've mentioned about the signs and symptoms, it's very simple. It's from text B. Okay, so changes in skin color. So discoloration of the skin. So that answer is it is from B, text B. Okay, so that is B. Second question. The significant stages involved in treating cardiac tamponade medically. So my keywords, stages, then treating medically. So the management, where they've mentioned about the management, yes, it is from text D. Medical intervention, medical management, what are the stages mentioned? Yes, it's all about D. So my answer is D. Okay. Then the third one, what are the factors that cause cardiac tamponade? So my keywords only factors. Okay, as well as I think I will mark the word cause also. Okay, the reason. So factors that is affecting the condition. What are the chances? What are the factors? So I think it's from text A because I found some factors here. See, in some cases, cardiac tamponade can also happen after medical procedure, and some of these include, so these are the factors. Okay, so my answer is from A. Understood? Yes. Then fourth one, which test is conducted to evaluate mediastinal widening? So my keywords tests, then mediastinal widening. So these are my keywords from fourth question. So what is your answer for this one? Which tests? So all the diagnosis mentioned, as you can see here, it is from text C. Okay, see the first bullet point, it's all about the mediastinal widening. So my answer is, of course, it is from C. Then the fifth one. What is the preponderance? Preponderance, which means the prevalence. Okay, the spread, simply I can say spreading the condition. So preponderance, which means the prevalence of cardiac tamponade. So preponderance is the only keyword which I'm marking from the fifth question, and my answer is, I don't even have to look for that because I know that it is only in text A. They have mentioned regarding the prevalence of the condition. It is about 2 out of every 10,000 people. So my answer is A. Okay, then sixth one. Yes, methods employed to manage pericardial pain and inflammation. So my keywords, methods, manage. Okay, so again, what about the management of the condition? Okay, so it's from text D. Then, so what about the methods? Yes, it is all about control of pericardial pain and inflammation. So answer is, of course, from text D. So my answer is from D. Then the last one from the first set of questions, abnormalities screened through electrocardiogram. So my keywords, abnormalities, electrocardiogram. So I know that the word electrocardiogram, which is referred or which is connected to that diagnosis. Okay, so I'm sure my answer is from text C. Okay, electrocardiogram. So definitely you can mark it as C. So these are the answers. First one is B, D, A, C, A, D, C. Any doubts? Okay, Reba, any doubts? No, right. Okay, so we are moving to the next set of question, which is 8 to 14. Here you have to take care of a particular instruction from the following because you can answer it in a word or a short phrase. Okay, so word itself is a word, as you know. What do you mean by a short phrase? Phrase, which means combination of words. Okay, short phrase, which means what? Maximum 3. Okay, maximum 3 words. Okay, Riba, yes. So, 8th one, a procedure on the right side of the heart that can unveil the presence of pericardial tamponade. So, my keywords, procedure, then right side, as well as presence. Okay, so these are my keywords, procedure, then right side, then presence. So what is the answer? Procedure on the right side. Okay, the procedure mentioned. So maybe I guess it is from procedure, it is from text D or from text C, I'm sure. Right side as well as presence, pericardial tamponade. So definitely I'm going to text C. Yes, very good, Reba. It is catheterization, dear. Your answer is correct. So I got that answer from text C. The last bullet point. Catheterization of the right side of the heart reveals pericardial tamponade. So answer is catheterization from text C. Okay, so catheterization. Then 9th one, a medical device. Okay, placement associated with the development of cardiac tamponade. So my keyword, medical device. Only 2 keywords, medical device. So what is the name of the device? A medical device. So again, medical device placement associated with, connected with development. So the development of the condition, of course, it's all about text A. Development of the condition. So what is the device using here? See the last one, placement of a device like pacemaker. So my answer is pacemaker from text A. Clear? That is pacemaker. Then 10th one, the ultimate management for ongoing hemorrhage. Okay, yes, very good. It is pacemaker. Okay, Vidya, it is pacemaker. Very good. Okay, so the 10th question, ultimate management for ongoing hemorrhage. So my keywords, ultimate, management, then ongoing. I'm not marking hemorrhage. My keyword is ongoing, okay? So yes, what about that one? Ultimate management. So management of the condition. Where is it mentioned? Management. So I'm moving to text study for looking into the management of the condition. So there I found this word from this, what is the answer? From the last point. Okay, step 3, surgical repair. Okay, I got the answer from text study. My answer is surgical repair, and that is the procedural intervention. Okay, preparation for periocardiocentesis. So my answer should be what? Surgical repair. So what was the question? This question is little bit tricky, I know. Okay, so what was the question? The ultimate management, which means the final management. So what is the final management here? It is surgical repair. Very good. So it is surgical repair from text study, the last step. Okay, Riba, yes, Vidya, it is surgical repair. Very good. Okay, so now the next one, 11th one. Apart from other diseases, what can be the significant etiology of cardiac tamponade? So my keywords, significant etiology. Okay, so these are only my 2 keywords. I know that this question is very lengthier, but still, yeah, significant and etiology, these are my keywords from the question. So what is your answer? Any idea? 11th one. Apart from other diseases, what can be the significant etiology of cardiac tamponade? Okay, so answer is from text A. I got that answer from text A. So my answer is medical procedure. Okay, in some cases, cardiac tamponade can also happen after a medical procedure. So these are the chances, or these are the factors which include. So my answer is medical procedure from text A. Okay. Then 12th one. What is the second phase? Very good, Reba. It is medical procedure. I know that it is quite difficult, but still your answer is correct. Very good. Then what is the second phase of procedural intervention of cardiac tamponade? So my keyword, second phase, then procedural. So I know that procedural intervention, which is mentioned only in text D. Okay. So answer should be what? Okay. It is perio. Yeah. So answer is from text D, which I got that answer from, yes, this particular line, periocardiocentesis. Okay, so that should be the correct answer. Yes, something has happened. Yeah, so that's all about periocardiocentesis. Okay, so that is my answer from text D. Okay, Vidya, it's not actually evacuation fluid, guys. It is that particular procedure they're asking you, right? Okay, so 12th question, please read the question once again. What is the second phase of procedural intervention? So it should be a procedure. So which procedure, which step they're asking you regarding? Okay, so that should be, okay, you missed 1 mark, right? It's okay, Riba, I know. Okay, so answer should be periocardiocentesis. Okay, the preparation, the procedure they are asking you, so it should be the second step, second phase. What is the second phase after preparation? It is periocardiocentesis. Okay, then 13th one. What about 13th one? Okay, so yes, 13th question. Okay, which sign of cardiac tamponade can be elevated, reduced by following certain postures? Okay, so my keywords, sign, then okay, elevated, then posters. Okay, so any idea? 13th one, what is your answer? Which sign? So sign they're asking you about, of course, from text B, the signs and symptoms. So what is the correct answer here? Which sign? Which sign? Any idea? Okay, Riba, try to answer this one. What is your answer? Any idea? Which sign is indicate? Very good. Okay, chest discomfort. That should be the correct answer. Okay, so chest discomfort, that typically gets better when you lean forward or sit up. So answer should be chest discomfort. Alright, then the last one, 14th one, the detective tool to assure the presence of cardiac enlargement and mediastinal widening. So my keywords, detective, tool, as well as enlargement. Okay, so any idea? Okay, Vidya, very good. Your answer is correct, chest discomfort. Okay, 14th one. Which tool is using here? 14th one. It's all about the diagnosis, I'm sure. So the tool, okay, it is a chest film. Okay, a chest film is used to determine, identify the presence of cardiac enlargement, mediastinal widening. So answer should be chest film. Okay, answer is chest film. Okay, so it should be a chest film. Okay, I'm sorry. Yes, it is a chest film. Yes. Then the last set of questions, 15 to 20, which are fill in the blanks. So again, same instruction mentioned, short phrase. Okay, so 15th one, ST segment. I have only seen this particular word in which text? Text C, right? Yes. So the ST segment elevations and T wave changes are among the dash abnormalities that may appear on the ECG. So my keywords, ECG, ST and T wave. Okay, so what is your answer here? I know that it is from text C, of course. Okay, so my answer is non-specific. Okay, so what are the keywords there from the question? ECG, ST segment, as well as elevations and T wave. Okay, so the missing word is, of course, non-specific. Okay, yes, Vidya, very good, non-specific. Okay, and N should be in small letter, okay, because this is fill in the blanks. You don't have to write that N in capital letters here, so it should be small. Then 16th one, following the cessation, stopping of bleeding, dash is warranted following a period of observation lasting 12 to 24 hours. So my keywords, cessation, warranted, observation. Okay, so any idea what is the correct answer here? So that's number of hours, cessation, everything mentioned. It's about the management, I guess. So my answer should be removal of drain. See the last one from text D? Observation 12 to 24 hours. Those are the keywords. Bleeding mentioned. Okay, observation mentioned. So my answer should be removal of drain. Okay, so that should be removal of drain from text D. Then 17th one, excessive accumulation of fluid within the pericardial dash exerting pressure on the heart leads to cardiac tamponade. So my keywords, excessive accumulation and pressure. These are my keywords from 17th question. So answer is accumulation of the fluid within the pericardial heart, cardiac tamponade. So I guess my answer should be from text A. Yes, from the first line. Okay, so cardiac tamponade happens when the fluid sac around your heart fills with too much blood. So that is excess, okay, accumulation of thing. So that is fluid sac. So my answer should be fluid sac from text A. Then 18th one, cardiac tamponade can ensue which means follow, post-operatively following cardiac surgical interventions or procedures in close proximity connection to the dash. So what is it? Okay, 18th one. So what is the correct answer here? Again, I got that answer from text A. Okay, so my answer is pericardium. Okay, so pericardium. So surgery on your heart or near the pericardium. So my answer is pericardium, again from text A. Then the second last question, the management of pericardial pain and inflammation may involve the administration of intrapericardial dash along with dash via the IV. So here you have to find out two missing words. So what are they? Okay, management. So definitely I know that that answer is from text D, the management. So the missing words, what are the missing words here? I know it is all about intrapericardial steroid, intravenous narcotics. So my answer, steroids and narcotics. not and, okay? I think it is a comma, right? Yeah, so you can write here steroid as well as narcotics. Okay, that should be the correct answer. Then 20th one, the last one, detecting inflammation in your dash or dash becomes apparent when onset occurs gradually. Oh, a lot of answers. Okay, Anita, Vidya, Reba. Okay, so that is steroids, narcotics. Very good. Okay, so what about the last one? Detecting inflammation in your dash or dash becomes apparent, clear when the onset occurs gradually, slowly. So what is your answer? Identification, which means detecting, diagnosis. Of course, I know that's from B. Okay, so what is the correct answer? Identification about symptoms, detecting the symptoms. What are the symptoms? Very good. Abdomen, comma, legs. So where is that answer mentioned? Okay, it is mentioned here, abdomen, legs. So abdomen, comma, legs. So answer should be yes, abdomen or legs. Very good. Okay, Anita, yes, your answer is correct. Okay, so that's all about the 20 set of questions. So any doubts? Okay, if you have any doubts regarding any of the questions, you can comment it there. Definitely, I'll reach you back. Okay, so thank you so much for today. Okay, and please stay tuned for tomorrow. So same time. Thank you.